and psoriasis. So what it means that if you have psoriasis, psoriatic arthritis, and we test it for the gene, and the test is commercially available, and you have the gene, you may benefit from gluten-free diet. So which means that you need to eliminate products based on wheat, rye, and barley from the diet. It takes around 2 or 3 months before you notice a difference, but if it works for you, it can also make wonders, and it may reduce the need of other drugs.
And is it just celiac disease, or
no,
do you
gluten,
have a sense
in general, we're talking about gluten intolerance. I just want to repeat that the person on that here said that she's on low carb diet, which is not gluten diet, and her psoriasis got better by 9% without any therapy, right? How long did it take you to feel better?
I would say I started noticing the first month, and 90%, I would say 3 months.
So within the first month,
year.
within the first months, your symptoms got better, and after 3 or 4 months, you know, it's a major difference. That's about the right time frame where we see improvement in our patients who invent the theories, you know, about the effect of carbs on psoriasis in general. In general, there is a theory which is not 100% proved that when you're consuming a large amount of carbohydrates, not necessarily gluten, carbs stimulate proliferation of yeast in your gut, and they stimulate basically yeast overgrowth. And products of yeast metabolism can affect various inflammatory pathways, and in predisposed individuals, they can cause psoriatic arthritis and psoriasis. So that's one explanation. The question is whether collagenous colitis is related to psoriasis and psoriatic arthritis. Again, I cannot be specific in your particular case, but in general, there's a correlation between inflammation in the gut and psoriasis and psoriatic arthritis. A long time ago, around 27 years ago, there was a large group of publications, mainly from England. The publications were focused on the gastrointestinal health in patients with psoriasis and psoriatic arthritis. The way how the study was done, patients who have psoriasis and psoriatic arthritis, they were undergoing colonoscopies with colonic biopsies, and then colonic biopsy was evaluated. And what was found that approximately 30% of these patients, they did have changes consistent with various forms of colitis. So it tells us that approximately 1/3 of patients that do have changes in the gut. The question is whether taking multivitamins is beneficial. Again, you can get probably different answers from different physicians. My approach is it's my approach. So my recommendation is that you take vitamins for a reason. You don't take them just because you want to take vitamins, right? And before you start taking vitamins, you need to ask your primary care physician or your internist or your rheumatologist to check the vitamin level in your blood. And if you have deficiencies, then yes. If your level is normal, I would not recommend to take anything extra. Because vitamins, in my view, they're kind of like drugs. You take them for. Let me repeat the question. So basically, Remicade was working for a number of years, and then it stopped working, and then Enbrel was started, and no efficacy from Enbrel.
When we first started the care, and then it's still on it.
So there are different theories why Remicade stops working at some point. So one theory is that your body makes antibodies which neutralize Remicade, right? Because it's a chimeric molecule. It has a small murine portion in it, right? So the second theory is that something is happening with receptors, and antibodies don't work because they target a specific molecule. So maybe something happened with your body chemistry. Again, I can just guess. So, and then maybe TNF pathway is not the right pathway for you. So you need to talk to your physician, maybe to switch you to something else. Yes.
Regarding the gluten-free diet, in patients that you work with who try it, is there a percentage you see that it actually works for? And then the secondary question, I guess, are there things that someone who's considering gluten-free should look for and say, yeah, I had it happen to me, the gluten might work for you? Like, markers that it would make it more successful than not.
Well, we have our own approach in our clinic. It's not an approach which basically is well accepted, but we do genetic testing, and if we see that you have the gene like HLA-DQ8 or some other genes associated with gluten, we do tell you that you may benefit from gluten-free diet. We do also food intolerance testing in our clinic, and if we see that you have an elevated antibodies either in saliva or in your blood against gluten, it will be a strong indication to start gluten-free diet. If you go through all this testing and they show nothing, then our recommendation is not to try the diet, because the diet will affect your lifestyle. Let's put it this way, right? You do it for a reason, so you have a strong reason to do it.
So the people under your care then, so you'll do an actual, like a blood test, an allergy,
Yes.
and a whole thing to see
Yes.
if this works.
Yes.
It's not just a...
Not only for gluten, but for other things which potentially can contribute to psoriasis. So the question is whether probiotics will work for psoriasis. So it's a very good question. So there are only focused clinical trials on that. So there are just 1 or 2 trials which were published for probiotics in rheumatoid arthritis. And so what's been shown that there are specific strains of probiotics which can benefit patients with rheumatoid arthritis. Again, there's no any published data. In general, if you want to know whether you should take probiotics or not, you need to do a stool test to find out where you are with microflora. And if your microflora is abnormal, then you may benefit from probiotics. Again, probiotics like drugs, you use them for a reason, not just because you want to try. So the question is, if you're taking Enbrel and Enbrel is working for you, do you need to worry whether there's a chance that your joints will be damaged and you're kind of a little bit in the limbo, right? So it's a tough question, because again, what we do know that biologics, including Enbrel, definitely delay the progression of the joint disease. So they're true disease-modifying drugs, right? Whether it will be 100% protection or not, no one will guarantee. So how do we monitor this stuff? So in our clinic, we do a semi-annual ultrasound of the joints, key joints which are affected. And so we can assess inflammation of the joints, which we can assess the joint damage from the disease. And by doing that on a repeated basis, we can more or less predict. So you can do probably X-rays with a little modification of the specific areas and do the same thing. So, but if you do monitoring of the disease progression, within 3 or 4 years, you can get an answer what's happening. But it's not a simple answer.